Hello everyone and welcome to my channel. In this presentation I will talk about the new LCDC exam, also known as the Alcohol and Drug Counselor Examination by the IC&RC. And as many of you might know, there were some changes made to the test, and I'm going to talk about the structure of the new test that started in February of this year. So let's get started. The structure of the new exam is pretty much the same as the previous one. You have 150 questions with 25 pre-test questions. The total time to complete the test is 3 hours if you take the computer-based one, and 3.5 hours if you take the paper and pencil one. For the 150 questions, you have 137 multiple choice questions covering the 4 performance domains. This is where the biggest change happened. In the previous exam, you had the 8 practice domains, and now they combined them into 4 performance domains. It's pretty much the same topics with the same skills and knowledge, but now it is pretty much covered as 4 performance domains. And I will talk about this in more detail later on in future presentations. And you also have your case study, same thing as in the previous exam. The case study covers the 12 core functions, and you have 13 questions. Okay, so the 4 performance domains are for performance domain number 1, you have screening, assessment, and engagement. Performance domain number 2 is treatment planning, collaboration, and referral. Performance domain number 3 is counseling, and performance domain number 4 is professional and ethical responsibilities. For those of you who already took the previous exam, and if you're familiar with the 8 practice domains, you pretty much can see here that the current test, the new test, is covering the same topics. And if you need to retake the test, you're gonna have to just review the same topics you had to study for the previous one, and now we'll go into more detail later on. Okay, for your case study, you covered 12 core functions, as I mentioned before, which are screening, intake, orientation, assessment, treatment planning, counseling, case management, crisis intervention, client education, referral, report and record keeping, and consultation with other professionals. The format of the multiple choice questions is the same. You have 4 options for your answers. One of those options is the best answer, and the other 3 are distractors. These 3 distractors could be correct answers as well, but only one of those is the best answer because it covers all of the other answers. So it is a good thing to be familiar with the umbrella principle and use it when taking this test, because you choose the answer that includes all of the other answers, and that's the best answer for the question. And that's the format of pretty much all the questions on the test. Okay, this is the end of the presentation. Please don't forget to subscribe and leave a comment or a question for me. Visit my website, lcdcexamreview.com, what to expect and how to prepare for the updated IC&RC Alcohol and Drug Counselor Examination 2015. Thank you very much for watching, and I will see you in the next presentation.